I am going to talk about sciatic nerve block, especially three approaches: subgluteal approach, then popliteal approach, followed by anterior sciatic approach. I have taken some of the pictures from Elsevier Anatomy app. Also, I have taken consent from patient and volunteer. Regarding subgluteal approach, especially for a landmark guided technique, we need to understand two bony landmarks, that is medial side ischial tuberosity, lateral side greater trochanter of the femur. While considering the zona anatomy, one is gluteus maximus, another important muscle is quadratus femoris. Sciatic nerve is situated between gluteus maximus and quadratus femoris. Regarding anterior sciatic approach, we have to look for two important bony landmarks, that is medially pubic tubercle, laterally anterior superior iliac spine. These two landmarks connects and form inguinal crease. So another important landmark is femoral artery pulsation we have to look for. Again, considering the zona anatomy of anterior approach, we have to look for three muscles: all adductors, superficially adductor longus, then adductor brevis, followed by bigger muscle adductor magnus. While considering the popliteal sciatic approach, you have to look for laterally two muscles, that is long head of biceps, below that short head of biceps femoris is there. Again, in the posterior aspect, two more muscles on the medial side. We have to look for superficially semitendinosus, beneath that semimembranosus we have to see. Considering the lateral approach of popliteal sciatic, again we have to look for one of the important muscle, that is vastus lateralis. Another muscle is biceps femoris. This muscle is the long head of biceps. Again, if you remove that muscle, the smaller muscle is short head of biceps. Here we can see the sciatic nerve. Sciatic nerve has two important components and it divides above the level of popliteal fossa. The two components are common peroneal component, that is lateral one, tibial component, that is the medial one. Next, we are going to look for the nerve stimulator guided response. We have to start the nerve stimulator from 1 to 1.5 milliampere current. Then we have to slowly reduce the current between 0.3 to 0.5 once we get the preferred motor response, that is plantar flexion. This here important point is we have to rest the ankle so that we can clearly visualize the toe movement. First, I will start with subgluteal approach. In subgluteal approach, I am going to tell landmark guided nerve stimulator approach. Patient should be in lateral position. Preferably hip should be slightly flexed and the knee joint also slightly flexed. All these blocks are deeper blocks. Preferably you have to sedate the patient adequately. Also the skin entry area where we are going to put the needle, we have to infiltrate with the local anesthetic. Here the patient is in lateral position. I will start feeling bony landmarks. Laterally I will look for greater trochanter of the femur. Medially I will look for the another important landmark, that is ischial tuberosity. So now I am going to connect, and line is already there, the connecting line. In this connecting line I am going to find out the midpoint. In the midpoint we have to choose, then we have to look for again another perpendicular line caudally for 4 centimeter.